Welcome, everyone, and thank you for joining us today on the last day of National Nutrition Month. My name is Megan Harrington, and I am the program manager of the nutrition program at the Celia Weatherhead School of Public Health. I also have the privilege of working alongside our student nutrition leadership trainees through our HRSA-funded Tulane MPH Nutrition Leadership Training Program and the USDA-funded Louisiana Collaborative for Excellence in Nutrition. We are proud to host this webinar in partnership with the Tulane Undergraduate Public Health Nutrition Program. We are thrilled to have three public health practitioners with us today who will share a bit about what drew them to public health nutrition and the diverse range of careers that exist within the field. We will take all questions at the end of the panel session during a 15-minute-ish question and answer period. However, you can ask a question at any point during the webinar by entering it into the Q&A box at the bottom of your screen. The recorded webinar will be available following today's session on our Tulane Nutrition YouTube channel and will be shared with all who pre-registered for today's event. A survey link will be shared at the end of the Q&A session. Please take a moment to complete this short but really important questionnaire. Your feedback helps us evaluate our work and improve future webinars. And now I'd like to introduce a few folks from our team who will be providing logistical support today. Amanda Banks is a first-year MSPH nutrition student at Tulane and a HRSA-funded MCH nutrition leadership trainee. We'll be monitoring the chat and Q&A box. Our moderator today is Sarah Merchant. Sarah is a first-year MSPH nutrition student at Tulane and a HRSA-funded MCH nutrition leadership trainee. Please join me in welcoming Sarah, who will introduce our panelists.
Hello, everyone. I'm so happy to have everyone here, and we're also lucky to have the three panelists with us today. So our first panelist, Erin Marini, she's a registered dietitian, a licensed dietitian nutritionist, and she has her MPH. She is currently the clinical nutrition manager at an acute care hospital in Southern California and the founder of Odyssey Nutrition, a private practice specializing in the prevention and treatment of chronic diseases. She earned her Bachelor's of Science in Applied Nutrition from California Polytechnic State University in San Luis Obispo. She became a registered dietetic technician and later completed her MPH in nutrition and dietetic internship at the Tulane School of Public Health and Tropical Medicine. Erin brings a diverse background spanning clinical dietetics, research, and private practice management. She is a registered dietitian that is passionate about delivering evidence-based, accessible, patient-centered care and advancing nutrition practice across settings. And then today we also have Lindsey Reed, who has her MPH and serves as a senior research analysis for healthy eating research. In this role, Lindsey serves as the main program lead for all commissioned research subgrants and a content expert for special projects, assists with review processes for healthy eating research's funding opportunities, and coordinates the healthy eating research working groups. In prior roles, Lindsey supported a research project exploring the environmental impact of national dietary recommendations and developed evaluation tools and metrics to support a citywide community collaborative seeking to improve health equity in New Orleans. She also served in the Peace Corps in Botswana and was operations manager for a nonprofit in rural Western North Carolina, providing access to fresh produce through mobile markets. Lindsey holds a Master's of Public Health and Nutrition from Tulane University School of Public Health and Tropical Medicine, and a Bachelor of Science in Health Promotion from Appalachian State University. And then we have Lauren Bell, who has her MPH and is currently a PhD candidate who strives to bring energy and excitement to the world of public health and nutritional sciences. Whether it's a research proposal or a TikTok, Lauren is ready to explore how food impacts our health. This fervor, coupled with experience in teaching, leadership, and data analysis, has provided a comprehensive skill set essential for pursuing a PhD. She is currently a member of the, correct me if I'm wrong, the Polos Food Security Lab at the University of Texas in Austin. Her research interests include food access, food security, healthy behavior, and sustainable food systems. Thank you again to all of our panelists for joining us today. And let's start off with our first questions. Okay, and this question, I'll just direct this first one to Lauren. What drew you in general to public health and more specifically to public health nutrition?
Sure, and thanks for having us. I'm excited to talk to everyone. I went back to get my MPH in 2020, which was around the time of the pandemic beginning. So I think that that was obviously top of mind for a lot of people, and I was working in a completely different career. I thought it would be a nice pivot because my undergrad degree was in psychology. And I had a bit of a background in that form of public health, but I really was drawn to nutrition because I had my own health problems that I had to figure out through nutrition, and I realized more people should know about it and be taught about it. And I wanted to go back and do that. So that's what led me to getting my MPH.
Okay, thank you so much for sharing. And if I can just direct the question maybe to Erin. What also drew you in general to public health?
Yeah, yeah. Thanks again for having us. So I knew I wanted to be a dietitian, but when I was looking at kind of career paths, I could have taken the route of going into like a clinical nutrition, higher education master's degree or a public health degree. And I just kind of realized that I would be a better practitioner. I would be a better dietitian with a public health degree because, to be honest, public health, changes how you view the world. And I feel like looking at humans as a whole person and how their experiences and environments have impacted their life is really necessary in being successful with any type of nutrition therapy that you would be trying to implement. So, yeah, I've always loved kind of traveling and doing international things. And so all of that kind of factored in when I was looking at what my future career path looked like.
Awesome. Thank you so much. And it's the same question again, but I just to get us started. What drew you in general to public health? And this is directed towards Lindsey.
Yeah, thanks, Sarah, and thanks everybody for having us today. So in undergrad, when I was at Appalachian State University studying public health, we had to do a practicum, and my practicum was the summer after I finished my coursework. And so I ended up taking a practicum working for a local nonprofit outside of Asheville, North Carolina, in the mountains that was like a mobile community food pantry. And I just absolutely adored working with people on a daily basis, doing some like monitoring and evaluation and survey development with that group. It was in the very early stages of that nonprofit, so I had a unique role of being able to do everything as a very underqualified individual, which was the best way to learn. Prior to that, I was not considering public health nutrition. It was not something that was top of mind, but I think that really sealed the deal for me, and then ended up going into Peace Corps and was supposed to be focused on HIV/AIDS and capacity building, but it felt like every conversation that I was having, people were so interested in learning more about nutrition and growing food and how food helps you. And so that really just kind of set it in stone of, okay, I'm really passionate about this topic area, and I just want to go back to school to actually develop the skills to be able to work in this area. So those are the two experiences that I feel like really led me into the field of public health. I personally feel like the reason why I am still in it and why I love the field of public health nutrition is because there's such a variety of settings and applications for this content area, like from community-based nutrition to research to policy and advocacy to clinical work. So you can work in so many different settings, but there's also so many different topic areas. It's not like you're not pigeonholed. You really have a wide range of different areas to develop content expertise. You could work in federal nutrition assistance programs, community interventions, healthcare interventions. it just feels like the opportunities are endless and really a field that you can like truly build a career in.
Awesome. Thank you. Um, and I'm going to ask maybe more specific questions just based on your bios, but Erin, you like as a clinical nutrition manager at an acute care hospital, like what are the most significant challenges you face when moving from direct patient care role into like a leadership and administrative position?
It's a great question. I actually didn't think that I was going to be in clinical for a long time. I had always worked like I was a clinical dietitian, like per diem on weekends in New Orleans, just to, make some extra money and, use the credential that I had worked towards for so long. But I actually wanted to do international nutrition work long term. And now with the state of things, I think it just was kind of a pivot that needed to happen at this point in my life. But um, yeah, so the role has been challenging as my first management role in general. Managing a team of dietitians who are very young and very new dietitians. And in the grand scheme of things, I too am a relatively new dietitian. So I think leadership, a lot of it has to do with building rapport. Like it's having to have tough conversations in a positive way, I think is what I've been learning. Something kind of niche that has been a particular challenge for us is we are actually covering a NICU. So, if anybody's familiar with dietetics, NICU is a very specialized part of nutrition, in the dietetics field. So, most of us don't have close to any training in NICU, when we come out of internship. Or any type of education on it in general. And so when I took this role kind of fell into my lap. But when I took this role, they were saying, hey, you're going to have to learn how to cover the NICU. And none of my team had any NICU experience. So we all had to learn together. And we learned an entire specialty in about 3 months and are now pretty independent with it. Our hospital is in I don't know if I would consider it a rural area, but we're in the high desert in Southern California. There are a couple hospitals nearby, but we are the level 3 trauma center. So we're the highest trauma center. We're also the only NICU in the area. So it's just a necessity that we kind of had to pivot. And I had to be like, okay, instead of focusing on, these management things, we're going to have to figure out this specialty so that we can provide, the best patient care possible. And yeah, that I think challenged my management a little bit more than anything else because it was something that I was also learning alongside. And so there wasn't so much of this, I'm the manager and everybody else is, you know, kind of down here. We're here. And I try to maintain that on a daily basis and saying, hey, we all have something to learn. We're all going to have different strengths. We're all going to have different weaknesses. I am not superior to you in this capacity. And so that has really helped to kind of build the team up in a way that people feel comfortable coming to me with different things and it's a very open dialogue and we're just, taking it day by day and doing what we need to do. So hopefully that sort of answered the question. But yeah, it's been a challenge for sure.
Yeah, no, it definitely answered the question. That's very interesting. Like I'm sure like all the teamwork that you got, it's been a lot of teamwork building, like learning something new together. Yeah,
Yes, definitely.
thank you. Um, and then another more specific question for Lauren. You mentioned bringing energy to public health through platforms like TikTok. Um, how do you simplify sometimes like more complex nutritional science topics for like a general audience if you are on a platform like TikTok or like how do you engage with your audience and make them interested in nutrition?
Great question. I think I like to talk to people like they're my friends. And my friends do not have a background in nutrition or public health necessarily. So, kind of like what Erin just mentioned briefly, but like I don't ever want to think that I'm better than someone or above someone in terms of health communication. because I don't know everything, but the things I do know, I think it's really important to convey that in a kind way, in a friendly way, and not a I know better than you because I have this degree way, but also framing everything I say from a scientific lens and providing context and articles that people ask, or like just showing where what I'm saying is coming from so that it's not like I'm just talking, but rather like, hey, this is what I'm seeing, this is what it means, which can be sometimes difficult in the academic community, but that's how I like to view it. I try to film things like I'm talking to my friends.
Yeah, no, thank you. That makes a lot of sense. You want to be like approachable. Yeah. And then a more specific question for Lindsey. You talked about working on exploring the environmental impacts of dietary recommendations. How do you translate like complex multivariable research like that into this is kind of similar to the previous question, but like into messaging for the general public or even policymakers so they can actually be used?
Yeah, that's a great question. I actually do a lot of that in my current role with healthy eating research. So all of the work so healthy eating research, I'm not sure if this was really clear in the bio, but we're really a funder and we're also a convener, but we only fund research that's very policy relevant. And a major part of my job is taking the findings from our grantees and communicating those findings back to policymakers. So I write a lot of issue briefs. I write a lot of fact sheets, documents for parents and caregivers. So I feel like really it just depends on who your audience is and how you're approaching that communication. I feel like for policymakers, we typically say that like whatever you're handing over to a policymaker should be no more than 4 pages, but ideally closer to 2, so 2 to 4 pages. And you really just hit on the key points of what they absolutely need to know. I think that always taking a step back from the content and taking a really high level of view of what are these key findings, what does this actually mean, and why does it matter for this specific audience is the first step for figuring out how to communicate any kind of information to whoever you're trying to communicate it to. I don't know if that answered your question.
No, I know what you mean. And recently we were on through our leadership, our MCH leadership training, like we went to a conference in DC and they talked about how when you laying information to representatives that like you want it to be short because they only have a certain amount of time, and if it's too long, like they won't read that. So I understand that. That was very helpful.
Yeah, totally. And usually like their staffers, sometimes you can give much more detailed information to, like sometimes you can give maybe more of a report style, like 5 to 10 pages with a lot of references and some more key highlights from evidence that they can review and see if they want to pull out into talking points or something like that. But when your target audience is the policymaker itself, it's usually like 2 to 3 pages is the goal.
Yeah. And another question for Erin, like back to your private practice, what motivated you to start a private practice? Wait, sorry, I asked this question. I'm so sorry. As a clinical nutrition, okay, never mind. So sorry. What motivated you to start a private practice while maintaining a clinical leadership role? And how do these two environments differ or inform each other in your daily work?
Yeah, so I actually started the private practice right pretty much immediately after graduating from the internship and passing my RD exam. I think I'm just always someone who has backup plans. And for me, I wasn't sure if I was going to stay in New Orleans for a long time. I wasn't sure, if I was going to do this, try to pursue more of that international nutrition route. Just there was all these things that I was like, you know what, like let me just start to build a private practice. My private practice is fully remote. So I knew that I could take it anywhere. And to me, that was a bit of looking forward for job security. Um, because, we don't get paid a ton as dietitians, and honestly, in public health in general, like we know that it's not the highest return on financial investment in the world, right? I wish it was, but a lot of us are in this because we love it and we're passionate about it. But for dietitians in particular, if you are a single income household, you got to be creative about how to pay the bills and how to pay off loans and do all those things. Having a master's degree requirement added to being a dietitian was a huge, huge thing that made it a lot more expensive to become a dietitian, which is, frustrating and kind of a different conversation, but it is what it is. So my thought was, hey, like I'm going to basically create a job for myself that I can either keep in the background while I'm doing something else, or that could be my, sole job. My family, I grew up in California, I went to college in California, so I knew that like my time in New Orleans wasn't necessarily going to be forever. And so my thought was, job security in that way. Um, but private practice and clinical nutrition are similar yet different. I mean, in a clinical setting, because we're in an acute hospital, acute care hospital, nutrition education and talking to patients is quick, right? We have a few minutes to try to make an impact on someone in the hospital, before, the nurses come in, the doctors come in, all these other things are happening. And to be honest, nutrition is not always the sole, priority with patients that are in the hospital. They're not necessarily in the right headspace to hear nutrition education that's going to really make an impact. So that's where outpatient nutrition education comes in, and outpatient medical nutrition therapy, which is more so what a private practice is. Um, it's just, an individual person or group of people versus like a outpatient facility attached to the hospital, which we don't have. So that's also a big problem. But yeah, a lot of the conversations are similar. We're giving out similar handouts and, evidence-based practice and things like that. But with private practice, you can really get to know people. I mean, you're seeing them potentially weekly, for an extended period of time. I've had clients that I've worked with that were like my first clients ever with my private practice that I've worked with for a few years now. And then some people are, more short term and have goals, and we hit the goals and then they're like, okay, cool, I've got what I need, moving on. Um, so they each kind of have a place, a hospital has its place, but private practice is really for that. All right, patients are coming home, they need long-term support. And um, you have a lot more diverse conversations in the private practice setting, and you're really getting to know people in their life, and what's impacting them. And the hospital is very, very minimal. Um, so hopefully that
No,
answers a little bit.
no, thank you for sharing. Um, and this question can kind of be directed at anyone, but what did your career what did your career path look like, and like how did you get to your current position or organization? I know we've kind of like talked over this a little bit, but if anyone wants to emphasize something on their career path, or like something that really pivoted them to where they are now.
I can start. Um, well, initially I graduated with my MPH in 2022 and I stayed in New Orleans and was working for the Louisiana Department of Health. And I did not have any plans to go back to school at all. And then I was working for the Department of Health and I thought there's got to be something better than this.
He just has it
And I
wrong. I'm
wanted,
doing it. Yeah.
I think Amanda, oh, there you go. I think after that, I really sat with myself and wanted to make sure that if I wanted to apply to a PhD program, that I was determined on that. So I took it was pretty much a year from when I graduated to when I decided to apply that I said if I still a year later I'm thinking about doing a PhD, then I'll actually look into it. And I was. So then I started reaching out to different professors or friends that I knew from my MPH who decided to get PhDs and a few professors from Tulane too to just get their opinion. And after that, I just kept applying, and then somehow I ended up here. But it's been great, and I think it's nice to be focusing on work that is tangible and community oriented. And I think a lot of the background I got in my master's helps with that because what I've definitely noticed in my program specifically is that there's a lot of background in science, but there isn't a lot of background in people-centered work. And I think that's kind of the best part about getting an MPH is you're learning how to do real-time interventions and evaluation. And I've noticed that in my program now, people are trying to do interventions or do studies and they have no idea how to scale that or how to evaluate it or how to program plan for it. And that's kind of the entirety of the MPH program. So I felt very prepared. And I think the combination of both my MPH and future PhD title will make me very prepared for doing any work with public health interventions, which is still kind of my focus, especially with a concentration in nutrition, which is kind of my bread and butter and favorite part of the MPH. So yeah.
Awesome. Thank you for sharing. And kind of going back to you deciding to get your PhD, is there any like specific like research or research questions that you're interested in exploring? I mean, I know you kind of went over, but like more specifically.
Yeah, so a lot of my work is focused on food access and food insecurity work, which kind of stemmed from a class I took in my MPH called Local Food Access. Pia Chaparro taught it, but I think she's now at UW. But anyway, she was great. And that made me really interested in what local food systems look like, especially for young adults. So a lot of my research and research questions are around how lack of food access leads to chronic disease development versus, the kind of standard thought, which is that people just eat ultra processed food and they have chronic diseases. I'm more interested in the root cause of why is it that most people only have access to those foods and can only afford those foods. So that's kind of what I'm looking at. I'm specifically now looking at college students because they're kind of an understudied population. Most people assume college students are fine, though I believe the numbers now are about a fourth of college students are considered food insecure. And at bigger universities, that number tends to go up. So I like looking at that and seeing how currently I'm seeing how it impacts their mental health, their chronic disease development, because it's a really great space to capture people to teach them about taking care of themselves. Because once they graduate, they're kind of out into the wilds. And that's when I feel like disease development happens, which it starts at a young age. So, yeah.
Awesome. Thank you for sharing. We have a question in our Q&A chat. Can you I don't know if this is I think this is maybe to anyone or maybe to Lindsey, but can you elaborate on what international nutrition roles look like? But anyone can answer.
Yeah, I can attempt this with the disclaimer that I have never had a paid international role. My Peace Corps volunteer opportunity, I don't think counts as an international role in this context. But so when I was a student at Tulane, I thought that I wanted to do international nutrition work. And that was really what I was interested in, mostly stemmed from another class of Pia Chaparro's called The Double Burden of Malnutrition, which was a great class. But from my understanding, there are several different ways that you can get into international nutrition work. One being working for an international organization that has programs operating in specific countries. That could be Helen Keller International, CARE International, FHI 360, lots of different organizations that might be headquartered in the US or in another country, but have programs implemented within specific cities or certain countries. So that's one way, which I imagine those roles are a little bit more like project management, maybe some program monitoring and evaluation. But I don't really know exactly what those roles look like on a day-to-day. The other way that I think you could get really involved in international work is working with researchers based in the US that have international projects, like a research project, which might be doing some really large scale monitoring and evaluation, which I know several professors at Tulane are engaged in. So those are just two different avenues that come to mind. I know that list is not exhaustive. I mean, you could also work for like USAID. Well, never mind. That's really sad. Okay, that's not an option anymore, I guess. But yeah, those are the main ideas that come to mind. I don't know if any other panelists have thoughts.
I have some insight.
Great.
Also RIP USAID because that's where I wanted to work for the longest time. Anyways, so after graduating college, before starting my master's program, I worked with an organization based out of Washington University, St. Louis. So what Lindsey was saying, the second part of like working with the university or a organization that has research projects internationally, that's what I did. And so they had the project was called Project Peanut Butter. It was working on moderate and severe malnutrition recovery in infants to 5-year-olds in Malawi, which is in East Africa. The project itself had, I think, four or five different sites around Africa. And so that actually, like working with that malnutrition research study, really kind of was my solidification into wanting to pursue more about international nutrition. And kind of leaning the public health way versus the clinical nutrition master's degree way. And that's really the reason why I chose Tulane was because they had an international focus, among other things that were, helpful to me in my career. But Tulane has a huge international presence. And I remember when I was in Africa, I heard the name Tulane. And then, of course, all the Washington University researchers knew of Tulane and things like that. So that was really cool. But that's another way that you can get involved. Obviously, I was volunteering. It wasn't a paid, we got like a stipend, but it wasn't a like paid opportunity necessarily. But the higher level researchers on the project were. So that's kind of a way that you could use or be involved in international nutrition, and then also not be necessarily full-time based out of the US. I know some people would love to just live in Africa forever, and then other people are like, hey, I'd rather be based in the US and be able to do, smaller trips abroad, and use your skills. So, yeah, and I got involved with that project because one of my undergrad professors was one of those higher level researchers for that organization. So, really cool connection there. But yeah, like Lindsey said, there's a lot of different ways that you can get involved. Right now, it's funding is a struggle. And so I think a lot of these projects aren't necessarily maybe as well funded as they used to be, or the whole research world is a little bit just kind of figuring out what's what and what we can do. But yeah, really, really cool opportunities. Yeah, hopefully that helps.
Thank you guys for sharing, especially, yeah, with a question like that. It is a really hard time to, even I know myself, like looking at international work, it's a difficult time to see what's out there and get involved. And then a question for Lindsey, because we were just talking about your Peace Corps experience, and I know you touched on it earlier about how this like influenced like your future career, but like how did your time in Peace Corps influence your approach to addressing food security and public health back in the US? Yes.
Yeah, that's a really great question. So at the time when I was in Peace Corps and coming out of Peace Corps, I was really focused on community-based work and really prioritizing like people-centric, people-oriented programming. And I know Erin kind of briefly mentioned about that in the context of her dietetic work of just like really focusing on the individual. And that is what I was really passionate about coming out of the Peace Corps. And I think in some ways my experience with Peace Corps combined with my experience with Bounty and Soul, which was the nonprofit that I worked for in Western North Carolina that was also community-based, kind of actually had an opposite effect on me, where I started realizing, well, these community-based programs are so important and they can be so catered towards the needs of the individuals and the communities, which all programming should be. But I also see there being so many limitations with the policies that are in place and the systems that are in place. And to some extent, the livelihood of communities may not be significantly improved if policies aren't changed. And so that is what actually really motivated me to be in my current role that I'm in with HER, which is more focused on policy systems and environmental strategies. So I actually, it kind of had the opposite effect where it made me take a step, kind of a higher view of the entire public health nutrition system and look at food access and barriers to food access from a higher lens, if that makes sense.
So that does. Thank you.
Just a quick question for Lauren. I think a lot of people in the chat are curious about recommendations that you could make to undergraduate students that are new in this realm, or just different things to be focusing on as people interested in going into higher education, masters, the DI program, things like that. As you're in your PhD program, you obviously have had a lot of experience in this. Do you have any recommendations for students or things they should keep in mind to like set themselves apart from the general?
Yeah, for sure. I think that it's really important, especially as an undergrad, to look at different professors' work that you can maybe join in on. Like you could volunteer to help with research. You could look at their research, read their papers, go to office hours. One, that'll be great for like getting recommendations for grad school or even jobs, but also it could help you figure out the type of work you want to do. Especially as an undergrad, I feel like there's so many different lanes you can go in with public health, and even for higher education too. And it will give you exposure to grad students so you can talk to them and see what they're studying, what they're doing. And I think more hands-on experience with actual research will really dictate whether you just want to get a master's and go work, or you just want to work, or if you want to do more research-focused stuff and write papers. They all are kind of different avenues. But I think the thing that helped me the most was probably working one-on-one more with professors in my master's and my undergrad, because it helped me decide what type of research I wanted to do, because I was looking at their research and seeing which questions I still felt needed answers, or which groups of people I still felt needed more research on. But I definitely would not just apply to apply. I think that that wouldn't be helpful to anyone's growth. I think you should really sit and decide, like, do I really want to research this, especially for a PhD, because it's a long time. And if you don't like what you're studying, it won't be fun. So it's good to figure that out in undergrad and maybe even work after undergrad.
Yeah, I would just echo what Lauren was saying. One other like thing to kind of recommend for folks that are just getting started is that I would not feel pressure to find your area of expertise or your topic area that you want to focus your entire career on. Like these things change, they change over your entire career. And I think to some extent, like casting a broader net actually probably makes you a stronger candidate in a lot of situations because you have wider knowledge. Obviously, being a PhD student, that's very different. I'm talking about not the PhD path, but I think, yeah, just identifying like what those transferable skills are and maybe focusing on those skills. I know when I was in grad school, one thing I was really stumped on was, should I actually be focused more in epidemiology so that I have more data analysis skills and I have those more like concrete technical skills? I ended up learning some skills in some of the coursework and then tried to teach myself some stuff, and none of that stuck. But I was very worried that I was going to be in a role that required that. I've now been in my role for almost 7 years, and I have not needed to analyze anything. So that is not a skill that I have needed, but I do think that that's like something to consider of data analysis. There's lots of different areas that you could develop your own, skills in, like data analysis and research. You could focus on grant writing or management, which could be applied in any content area, even if it's not nutrition. You could be more focused in advocacy and policy, similar, could not be related to nutrition. In like communication and writing, there are whole roles that do exactly what Lauren was talking about with like communicating over social media, and also what I was talking about with communicating over issue briefs. You could also focus on like community engagement and then the clinical side of things. So there's so many different areas where you could really develop your skills without feeling like you have to limit yourself on a very specific content area within nutrition. So just to add that.
Follow up with that. Kind of going along with what everybody's kind of been saying, public health has obviously had a lot of big shifts lately. What are some recommendations that you guys might have with the lack of funding, the shift in like perspectives that people are having? Have you guys noticed anything, or do you have any recommendations on routes that people should maybe try attacking these issues in a different perspective? Or I know you, Lindsey, you were talking about kind of casting a wider net. Is that kind of how you would look at these situations? Or I guess I'm curious how you think people should get involved in this new state that we're in.
I guess just to kind of expand on what I was saying, I think it's, important to be open, and which I know is a very frustrating answer. And I'm frustrated by that answer for myself as well. I don't want to have to be open for my next job. I know exactly what I want to do, and I just want to be able to do it. But I do think that like if you have to take a job for 1 to 2 years, that's not your dream job. Like it's not a waste. You have no idea if you're going to end up really liking that job, that content area. You are most likely going to develop a new skill, which will make you an even better candidate for the next job that you apply for in hopefully a few years, when hopefully things have improved. One other like really specific piece of advice is that I think in this job market, if you have a contact with an organization, let them know that you have applied to a job and have them put in a good word for you. Or if they have any kind of connection to anybody at this organization, just having somebody send you an email on your behalf goes a really long way. That's actually how I got my current job, is because Diego Rose saw that it was posted and he sent me an email saying, hey, would you be interested in this? If so, come down to my office and let's talk about it. And so I think just having somebody be able to, send that email for you is huge, just to make you stand out, especially in remote roles where remote roles are getting thousands of applicants. You just have to be able to stand out.
Thank you. That's great. That's really helpful.
Thank you. And I'm gonna ask one more question, and then I think we're almost at our Q&A portion. So this is for everyone once again, and just kind of like how, for Erin, how did your dietetic internship at Tulane like prepare you for your current role? And then to everyone else, like how did your time in general at Tulane like prepare you for the roles you're in now? And I guess what are the biggest takeaways or skills you feel like you acquired here at Tulane?
I guess I can start. I'm not sure how familiar everybody is with the dietetic internship in general, but basically you go through a bunch of different rotations and you see a bunch of different basically avenues that you could take as a dietitian. So there's certain rotations where we have to spend a certain number of weeks at. So like clinical is a big one, medical nutrition therapy. So we'd be in a hospital, dialysis, food service. But then what was cool about the Tulane dietetic internship is it actually had way more rotations than most other internships had. They had, because Tulane is so integrated into the community, those community partnerships, we were able to have rotations at. So the Gold Ring Center for Culinary Medicine, that was huge. That was an awesome rotation. There was a lot of the garden projects, and different like sustainability focused things. So I felt like I came out of the internship very well rounded. And again, because I was kind of like most people in the internship, like there was a few of us that were like public health focused, right? But like we kind of have like one foot in dietetics and one foot in public health. And we're kind of like, let's see like where it takes us. We can kind of do either one. And so to have an internship that also had a very heavy public health focus was just kind of um, even better. We weren't just in the hospital for the entire rotation, right? So we were able to get outside and make connections. And we did research rotations, and that ultimately led to me getting my research dietitian role at Tulane, which is what I did for a few years after graduating the internship before I moved back to California. But super applicable skills, just a lot. Being forced to do so many rotations can sometimes it felt exhausting at times, right? Because every week you're somewhere else, but it also forced you to be meeting new people every week. And I think those professional skills of having to adapt super quickly, and be doing things without really knowing the organization, you're learning along the way, um, is really just helpful in any capacity. In any job that you have. Being adaptable is huge. Um, so yeah, I think that was kind of the benefit of doing the DI through Tulane.
Awesome. Thank you so much. And if no one has anything else to share on that question, I think we're going to move to the Q&A, and I'll hand it over to Amanda.
Hi, yes, this is great. This is a question that was in the Q&A, and I was also curious about. It's going back to Erin, but coming from a lot of us are coming from a much more clinical public health focus rather than a business perspective. If you could maybe give us a little insight as to how you started your own private practice, how did you learn those business skills or go about it? It just seems like a very big undertaking. It is obviously very rewarding, but I'm curious how you felt prepared to do that, what you did, some of those steps maybe.
Do it scared. Is really what it came down to. Um, yeah, and I'm happy to talk more about this offline too. It really is kind of intricate, and it also depends on like what your state, like
Yeah.
what state you're in. But a lot of just research, a lot of just like, okay, this is my next step. Like, I need to get this business license, and then I need to do this and this and this. And obviously, getting the RD credential is the number one step before pursuing anything further. But I kind of just almost figured it out as I went. I would run into, certain situations or, oh, you need to do this paperwork. Okay, let me research what that paperwork looks like. And you just kind of like muscling my way through it, because I didn't have anybody around me that had done it. And so, and I built my private practice like actually as a business, like an LLC. I also worked at Nourish, which is like one of those big platforms that does individual nutrition counseling. I did that so that I could have health insurance when I moved to California. So, there's different ways of kind of having a private practice. So I kind of did both. I had my own LLC, which is its own thing, and, have my own liability insurance and all of that, but then also worked for a company that provided the insurance contacts and things like that. So the hardest part for me about the private practice was dealing with insurance and deciding, do you want to do private pay? Do you want to, have everybody pay you a certain amount of money, or do you want to accept insurance? In which case, that is the complicated part, is getting those insurance contracts, the reimbursement, making sure everybody, has their claims straight. But insurance coverage in the US is very, very minimal. And so you have to be very creative about how you're billing and coding and doing all those things. So it's just a lot of research, but I'm happy to talk more about it if anybody has like particular interest in going that direction.
Yeah, that's great to hear. Thank you so much. This next one's for Lauren. Just coming from, I think you have a very interesting background with the education in psychology and mixing that with public health, nutrition. How have you seen that this background has shaped some of your work in public health, and maybe it's giving you a different perspective than kind of the general body that's going into these fields?
Yeah, I think it's helped a lot. I think psychology ultimately is like the study of people in a lot of ways, and obviously public health is kind of the practice of helping people. So I think in many ways kind of gives you better bedside manner with a lot of things, which though a lot of people in public health are very caring and thoughtful and try to be intentional, it can feel quite robotic sometimes, especially when you're doing data collection or working in different communities outside of your own. And I think psychology can give you a good background in working with different communities, and also um, even just like at a core level of psych, there's a lot of theory work that was very helpful and is helpful now in my PhD. Like I do interventions around culinary skills and teaching, so I'm using a lot of theories from psychology for that work. Um, so I think they kind of bleed into each other, and arguably psychology is also a part of public health because, you're helping people's mental health as well. So I think both kind of talk to each other. And I'm very happy I had that background because of the theory work I did in my undergrad. It helps with writing a lot of program design when you need theory backing for that. And also just trying to be a people person as you're doing data collection, which regardless of the communities, whether it's domestic or international, I think is really important um, to consider. Yeah.
Great, thank you. That's really a great perspective. Another one for Lindsey, you talked a little about how you are in the policy realm, but you don't have a kind of background like I've seen typically in like law or those kind of things. As somebody who I know I'm interested in policy, and I know a lot of people in public health are, but it might seem intimidating at times not having that law background. How would you recommend kind of getting your foot in the pond? How like just really kind of getting into that field, even though it seems maybe daunting at times?
Yeah, that's a great question. I would say most people that are in the public health space that are in the policy realm do not have a background in law, from my experience. Of course, there are several people that have their JDs, and that's great, but that's not the most common. I would say that my work is really at the intersection of research and policy. So in the grand scheme of like the policy realm for public health nutrition, it's probably a little bit more light on the policy work than other organizations. However, we partner very closely with several advocacy organizations. So for example, Center for Science in the Public Interest, CSPI, we work with them on a daily basis to understand what they are advocating for, what research questions they need answers to be able to advocate for specific policies. And so I think that you gain exposure to the policy space just through those partnerships. And I think if you can get an internship with an organization like that, that's a great way to see, like, do I actually really like this work? I have found that the advocacy roles are they are very heavy in advocacy and usually don't interact a lot with research. And so that's something that I've struggled with, is just how do you find that happy medium as somebody, for me, that's really passionate about both research and policy. but yeah, I think when you really get in the weeds on a content area, then you do end up learning a lot about the policies and the programs. And you, yeah, if you're willing to do the deep dive into that content area, then I think it can go pretty far. But I would say don't let the fact that you don't have a background in policy prevent you from pursuing that.
Great. Thank you so much. I think Megan's gonna take it and finish this off for us. So thank you, ladies. This is all great.
Yes, excellent. Yep, we're coming up on the end of our hour. Thank you so much to all of our panelists. For folks who didn't get their questions asked, please do not hesitate to reach out to nutrition@tulane.edu. I will pass them along to our panelists. Also, a quick reminder that a recording of the webinar will be available on our Tulane Nutrition YouTube channel for everyone who pre-registered. And last but not least, your feedback is incredibly important to us. I'm going to go ahead and share our last slide that's got a QR code on it. And it would be wonderful if everyone could follow that link and provide us with your evaluation. And again, a big thank you to Erin, Lauren, and Lindsey. We're so proud of our alumni and look forward to touching base with everyone in the future. Thanks everyone for joining today.